you just told Linda stay away from fruit juice. Explain.
Fruit juice, think about a cup of fruit juice is almost equivalent to 2 to 3 fruits. How long does it take for you to peel an orange, chew an orange? I would suppose at least a few minutes. How long does it take for you to chug a glass of orange juice? So we don't understand the concept of how easily this sugar has been concentrated into juices, and most of these clear pulpless juices don't even have the fiber in them. So you've lost the real nutritional benefit, and you have concentrated sugar, and you may have 3 or 4 cups of orange juice before you realize what you've done on a Sunday brunch.
All right, so let's take a larger look at this. All right, somebody comes into you, 5'4", 200 pounds. I'm sure you get that all the time.
Absolutely.
Okay, somebody sits down and says, you know what, I've tried a lot of different things, and I know I just feel a little sluggish. Maybe the person's not diabetic, or maybe is pre-diabetic. What do you do to that person that wants to do better?
Absolutely. It is very important that you said that word pre-diabetic. A lot of our society thinks that diabetes is a disease of blood sugar, and they think, okay, only when the blood sugar goes above, fasting blood sugar goes above 125, as the American Diabetes Association says it, you're a diabetic. No, but for 10 years prior to that, you have been pre-diabetic. The moment you started gaining more body fat, your pancreas is still making insulin, but the insulin is resistant. So what is happening is, in order to keep the blood sugar below 125, normal blood sugar fasting is 99 or less. In between is what we call pre-diabetes. So as the pancreas is trying to keep your blood sugar down, it's making more and more and more amounts of insulin. The problem is insulin. So high levels of insulin in the body makes your blood sugars fluctuate. You feel the fluctuation in the form of fatigue. And then insulin is a growth factor. That is why it makes you at risk for cancers. Cancers is basically nothing but an uncontrolled growth of cells. What is heart disease? Hardening of arteries is another growth. Fat plaques and other cells coming in and blocking the arteries, that is also driven by insulin. So the problem has been there for years, but you did not realize it. I do not want to diagnose a patient with diabetes. I want to catch them before the diagnosis of diabetes, when they are pre-diabetic for decades. And that is when we need to make the diagnosis. So what we do for such patients is that we run a complete metabolic profile, which will include fasting insulin levels, blood sugar, their cholesterol profile, kidney function, liver function, uric acid levels. Everybody talks about gout and gallbladder disease as, happens to everybody. No, it's part of this spectrum called metabolic syndrome. So we look for uric acid levels, fatty liver, and in men, testosterone levels. We do see a lot of testosterone deficiency in men, just like women go through menopause, but more often what happens is that the bioavailable testosterone goes down in men because it gets converted to estrogen in the body fat peripherally. So all of this can cause generalized fatigue. And how can I expect a person who's feeling bad to change their lifestyle?
Well, that's obviously the folks that are listening right now. I mean, every one of them is like, well, I should probably do this, I should probably do that. And there's like the disconnect. You're sitting there, you're 5'4", 200 pounds, you're kind of happy with your life and so forth. But to get from that, you almost have to go from 5'4", 200 to 5'4", 140 is almost a dramatic lifestyle change that is so hard to do for folks.
It feels that way because you have not gotten into your steps of doing it. And that's why when you have a direction like what we have, I'm very, very humbly proud of what we do for our patients. My best patient is a man who came to us because the daughter, not the daughter, actually the sister, felt that the brother is not going to be alive for even a year more if something was not done. And this person could not even lay in bed. He was 600 plus pounds. So he slept on a recliner. He had ulcers on his leg that he was being seen at the wound clinic in the local area, and he had vacuum attached to that. This is how his life was. This man now is almost 350 pounds lighter, not a diabetic anymore. He's going to be running the triathlon this year. It is doable.
So what is TAWL, T-A-W-L?
TAWL is, it stands for Dr. Tilak's aggressive weight loss, although it is not just weight. Weight is a word that is a buzzword that people love to hear, but it is basically changing the quality of your life by controlling these metabolic problems that we are talking about.